Okay, ready. Okay, Assalamualaikum warahmatullahi wabarakatuh. Hello guys, thank you for coming to this presentation. Let me introduce myself and my partner. I am Andika Putra, and my partner is Afita Sety Aji, Alfiyani Khoiriyah, Alisa Fikhul Fitriyah, and Anggi Nurin Kamarina. We are from class English for Nursing TAA Group 1. In this opportunity, we would like to present case from Nursing Ethical Dilemmas. Case 1. A 59-year-old woman suffered from severe smoking-induced COPD with associated hypoxia and hypercapnia. During a routine office visit, she said that should the need arise, she would refuse intubation and ventilation under any circumstances. Her physician fully explained the fact that patients in her circumstances often benefit from short-term intubation. The patient was twice intubated before, and she was terrified by the discomfort, loss of control, and loss of dignity. Her physician said that he will do all that he can to keep her comfortable and to make sure that the intubation period is as brief as possible. In spite of his assurances, the patient states that she absolutely refuses intubation.
Ethical decision making framework. Ethical problem is autonomy versus benefit. Ethical issue is freedom versus control. Problem statement. So the nurse continue to perform intubation and ventilation given to short-term benefit after the producer without paying attention to the fact of discomfort, loss of control, and loss of self-esteem for the patient. Thus, the nurse have to follow the patient not to perform intubation and ventilation under any circumstance because the patient refused to be given it regardless of the guarantee or benefit of the procedure on account the patient right to refuse.
Data gathering, relevant fact, the fact that patients in their current state often benefit from short-term intubation. Previously, the patient was intubated twice, and she was intubated fearing discomfort, losing control, and losing her self-esteem. Stakeholders, patient, the patient refuses to be given intubation and ventilation under any circumstances because the patient was previously intubated twice, and he was intubated for fear of discomfort, loss of control, and loss of self-esteem. Concern, nurse or doctor, the doctor explained completely the fact that patients in their current state often benefit from short-term intubation. The doctor declared that he would do all he could to keep her comfortable and to ensure that the intubation period is as short as possible.
Option. First option, the doctor will not intubate the patient. For advantage, patient will feel comfortable, do not lose control and self-esteem because intubation is not performed. For disadvantage, patient will feel comfortable, do not lose control and self-esteem because intubation is not performed. Second option, the doctor will still persuade the patient to perform intubation by explaining the procedure, benefits and disadvantages of not doing intubation, and telling the patient that the procedure will be carried out as comfortably as possible. For advantage, the patient gets short-term benefits from the disease, And for disadvantage, the patient will still refuse and the action of the doctor. Third option, the doctor will look for other ways to reduce COPD disease in patients other than intubation. Advantage, patients will feel comfortable, do not lose control and self-esteem because intubation is not performed. And for disadvantage, patients are not satisfied with the result of other treatments.
Decision and justification. Decision, the doctor should choose option 2. Justification, the doctor must consider the patient decision, but doctors also should not ignore the procedure that have been carried out. As much as possible, the doctor should be able to persuade the patient to intubation to reduce the discomfort of COPD, and the doctor must also explain the access intubation, the disadvantage of not doing the procedure, and the procedure so that the patient feels comfortable when the intubation procedure is performed. Thank you.
Okay, thank you very much for your great attention. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.